Pressure is a measure of the collisions of molecules against each other and against the container they are within. More collisions means higher pressure, so within this fully inflated tire you could imagine there are a bunch of air molecules that are all bumping into each other and bumping against the walls of the tire, pressing the tire outward, making high pressure, in contrast with this low pressure area in this flatter tire where there are less air molecules and they're not bumping against the inside of the tire as hard. Molecules in air or liquid have a tendency of moving from areas of high pressure to areas of low pressure. So for example, just as this gentleman sneezes, there's a whole bunch of air molecules that are very close together right at his mouth as they come zooming out of his respiratory system. And because they're all there and they're all moving, they bump against each other, and as they do so, that pushes them in all directions towards area of lower and lower pressure. So if we compared this area and this area, by the time the air particles get out here, they're much more spread out and the pressure is lower. And so molecules have this overall movement from an area of high pressure to an area of low pressure. Pressure can be changed in several different ways, one of which is to change the size of the container around the substance. So, for example, in this heart diagram, you can see by this right ventricle, when the right ventricle is wide and relaxed, there's lots of space for the blood to flow. Since the blood cells are very spaced out right here, that means there's an area of low pressure in comparison to that incoming blood which is coming in from the vena cava. And since it's very high pressure there, the blood tends to flow into the heart while the ventricle is relaxed. Contrast that with when the ventricle is contracting. Right here you can see it's getting narrower. That creates an area of high pressure inside the ventricle, and so all of those blood cells are bumping against each other so much that right out they go into the pulmonary artery. Our respiratory system gets air to move in and out of it by this same principle, by creating more space, areas of low pressure, for all of the air to come rushing in, and then creating areas of high pressure to squeeze all of that air out. And this large muscle underneath our lungs, called our diaphragm, is responsible for changing the shape of our lungs in just such a way. So first let's start with exhaling. It's a relaxing movement. You don't need to shove the air out of your body. Just by relaxing your muscles, a whole bunch of air comes shooting out of your mouth. Why would that be? During exhalation, your diaphragm, here shown in blue, relaxes, causing the weight of your ribs to press downward and inward, creating an area of high pressure inside your lungs. So there's a whole bunch of air molecules now that are really packed together inside your alveoli, all bumping into each other, and they're looking for a way out. And so out they go through the bronchioles, the bronchi, the trachea, the larynx, the pharynx, up through the nasal cavity, and out through the nostrils. Now, there was already some air to begin with out here in the air. However, those air molecules were more spread out and they were at a lower pressure, whereas these guys were at a really high pressure. And so they were bumping against each other a whole lot more, forcing them overall to move in this direction rather than to be moving in, thanks to the relaxation of that diaphragm. Contrast that with an inhalation. In this case, the diaphragm, also shown here, is pulling downward rather than relaxing upward. When it does that, it creates a whole bunch of empty space inside these lungs. So those air molecules that used to be packed together are now more spread out inside those alveoli, in comparison to the air outside, which is slightly under higher pressure. So now the molecules are bumping together more up here rather than down here. And so they start making their journey in through the nostrils, the nasal cavity, the pharynx, the larynx, the trachea, the bronchi, the bronchioles, all the way to the alveoli, again going from an area of high pressure and low pressure. So the areas of high pressure and low pressure switched thanks to the action of the diaphragm. This is our last dance. This is ourselves. Under pressure. Under pressure. Pressure.